Hi everyone. In this short video we would like to discuss some of the really salient and important points of risk management in relation to the governance side of clinical practice. As a health provider or healthcare provider, we are bound to maintain certain levels of quality assurance in our organization. And our nature of work in perioperative practice is quite dynamic, it's quite complex, it involves multiple professions to come together, and hence there are areas where deviations may occur from the accepted level of quality practice, and it may involve different health professionals. And we are ethically and professionally bound to be observing and maintaining the quality of or the standard of practice that we are required to undertake for patient care. If for some reason we are witness to compromises in the quality of care based either within the nursing profession or other clinicians' practices, we are bound to discuss and inform and report those deviations that are substandard, so the patient quality care is not compromised. In addition, from the governance point of view and risk management, we have a duty of care for open disclosure if patients are left at risk or patients have received harm. And then there is a procedural document on prompt specifically for addressing care requirements in terms of open disclosure to patients, in which where we take accountability for any harm that may have been affected the patient during their stay in our care. And then within the parameters of this procedural document, the team will take the responsibility to meet and express regret and apologize for the compromises or the harms that may have occurred, and they disclose all the nature of the adverse events, and then they will address any queries or issues or discussions that the patients or their family members may have had, and then that would be recorded and documented, and proper management plans will be put in place. Of particular note with this regard of risk management is our effective documentation as clinicians at the point of care as care is being delivered. Because in adverse events, if from a legal point of view we have to scrutinize the events, the lawyers or the legal team of both sides will focus their findings and their assertions and their arguments based on what we have documented as proof of care delivery. So it's very essential in all perioperative care episodes that our documentation is timely, it's accurate, it's objective, and it's relevant to the scenario or the clinical case that we have undertaken. And we need to be very vigilant and punctual, because these documentation requirements may be required 5 to 10 years later after care has been delivered. So memories will be fading quite rapidly in that duration of time, and the only thing that could be established as proof of that care in that time will be the page that we filled out for that specific case at that time. The other potential complications and hazard or risks we would like to discuss here is specifically affecting or potentially can affect staff members. And we look at the factors that would involve the team, the human capital of the organization, so to speak, and also the environmental factors. As a community of people, once we get together to perform our tasks within the context of that clinical setting or organizational structure, there may be potential for bullying and harassment at all levels. We need to be aware from a staff point of view, and most of us, when we enter the workforce from a junior level and work our way up, we need to be able to identify what constitutes bullying and harassment and what our pathways are. And we have got numerous documents available through the intranet and on the prompt that would specifically provide us with definitions, and online study module like I Belong will empower us to know what those resources are and what we have to do. This can come from different directions. There's a potential of, being affected through this process from colleagues, patients and relatives, visitors, and all walks of life. The other areas that may emotionally affect us is our performance is usually measured by how the whole team performs tasks or looks after a list. And then the allocations and workload from the patient demands point of view needs to be matched accordingly. If we have got a higher workload and a higher intensity of patients, complex cases, then the team assigned for the care of that workload need to be measured and matched accordingly. And if there are persistent issues with this regard, we need to negotiate and discuss this with our management teams, and also there is provisions for this under the industrial awards and also within the context of the organization. In addition to that, we also need to be mindful of how fatigue and stress may affect us. A healthy individual is known to be performing well in their role, and hence the quality of care will be ensured. And someone who is fatigued and stressed and their mind is occupied, they are more error prone, and that's when we see the adverse outcomes that we don't intend to see. Environmental areas may also include allergens, and there will be involvement of musculoskeletal demands at times, trying to restrain a delirious child, for example, or a delirious adult patient in recovery. We need to be aware of our limitations and strengths and seek safety in numbers, and we need to be aware of how we could maximize work efficiency safely in terms of when we have to activate a code grey, for example, and when we have to seek the assistance from a security team in a hospital setting post-operatively, for example. Hospital is a place where congregation of a lot of sick people do occur, and we need to be aware of parameters of safety in terms of the utilization of personal protective equipment, and there may be cases or situations where stimuli will affect us either chemically or from thermal and radiation, and again it takes us back to the provision of PPE utilization, and we need to make sure that our safety as a care provider takes the highest priority in all events.